Today you'll be receiving radioactive iodine treatment as an inpatient after your thyroidectomy. Radiation is a form of energy. We are all exposed to radiation from natural sources known as background radiation. This includes our environment, food, and the air we breathe. Radioactive iodine treatment involves ingesting radiation in capsule form. It is absorbed into the bloodstream from the stomach and brought up to the thyroid. This kills remaining thyroid cells that couldn't be removed during surgery. Excess iodine will leave the body through going to the bathroom or in sweat and saliva. This treatment is painless. You'll be required to stay in a single ensuite room for the duration of your stay. Radioactive iodine makes a patient radioactive for a period of time. This isolation is to ensure the safety of others. The room has large windows and a range of facilities to use, including fridge, TV, and phone. Before your treatment, you should avoid pregnancy or fathering a child for at least 6 months. The team will discuss pregnancy and breastfeeding with you. They will want you to be sure that you are not pregnant or breastfeeding before they go ahead with the treatment. This is because radiation would be harmful to a developing fetus. You are required to follow a low iodine diet for the time specified by your doctor. You will visit the endocrinology department, where you will be given a thyrogen injection to help stimulate the thyroid to take iodine in. You will have blood tests done. You will revisit the endocrinology department and will be given a second thyrogen injection. You will go to the nuclear medicine department and meet with the physics team. They will highlight precautions that you need to follow after treatment. Next, you will be brought to the Victor Singh ward, where you will stay during your treatment. In the morning, you will attend the nuclear medicine department for measurement. The team will meet you in your room and you will be given a treatment capsule. The radiation protection restrictions are in place at this point. You are asked to stay in your room during treatment. For a few days after treatment, visitors and staff are restricted from being in direct contact with you for their safety. Catering staff will leave food out for you to take into your room. Staff will check on you every day, but will not enter the room unless you need help. In the afternoon, the team will come to your room and take measurement. This tailors your radiation protection precautions for when you leave the hospital. This measurement is repeated in the morning. The team will discuss your hospital discharge and your guidelines to follow. At home, you should follow these guidelines for the restriction period, such as washing your hands after going to the toilet, flushing twice, and showering daily. Don't share cutlery, plates, and towels, and sleeping in separate beds. In the afternoon, you will need a scan in the nuclear medicine department. You will receive a phone call with information about your scheduled scan. Shower and dress clean before your scan. When you're going home, avoid long journeys and keep your distance from others, especially children and pregnant women. Avoid rush hour if you plan to use public transportation. If you are traveling through an airport or port within 3 to 4 months after treatment, you will be given a letter to take with you when traveling. In case of emergencies, the team will give you a special card to present to your hospital when attending. For any other information regarding this topic, please contact the RPA on 01 410 3000. Contact the Nuclear Medicine Department on 01 416 2753.